Hello, I'm Jessie Thebeau. I'm going to perform my CVC dressing change. I'm going to do a quick room scan so that you can see that I'm doing this based off of knowledge. This is my kitchen that we're in. Those are clean dishes. This is my room. The camera has to stay plugged in or it goes dead. This is my patient. He's got his mask on. He's already ready to do this dressing change. Okay. I don't want to fail because something that's so stupid. Okay. Get my camera ready. I'm going to try to place this the best I can. This is the best space I have to do this skill, but I don't have anybody to hold the camera. Okay. So, I have already checked the doctor's orders. The orders say that the dressing needs to be changed today per hospital policy. I've already informed my patient about what we're going to be doing, so he is aware. He has his mask placed because he likes to look around and watch what I'm doing. I'm going to perform my hand hygiene, and then I'm going to check out the insertion site on my patient, Mr. Thebeau. As I look at it, I'm going to palpate. Does that hurt? Is that painful around the site? Mr. Thebeau?
No.
Can you hear me? Okay. When I look at the tegaderm, it's there's no leakage or drainage on to the 2x2 on this side. So I'm going to start loosening the tegaderm just on the outside edges. And pulling towards the incision site. When I looked at this, I also saw that this is where the tubing's clamped down. The sutures are nice and clean. There's no redness. There's no pain. They're still intact. I'm going to apply my mask. Don my clean gloves. And before I get started there, I'm going to open up my sterile packages so that they're ready to go. These 2x2s really glued down well. Okay, there we are. Now, without turning my back on my sterile area, I can still see everything. That's clean. I'm going to fully remove the dressing from my patient. And I look at it, and it's clean. There's no drainage. The insertion site is still in there, and it's intact. I'm going to throw that away. I'm going to remove my clean gloves. Do hand hygiene. And I'm going to don my sterile gloves. I'm going to wait for my hands to dry here so that's not so difficult to put on. Make sure that alcohol's really rubbed in. Okay. Grab here. course, they never go on easy. I think my hands grew. Okay. Keep my thumbs up. Inside where it's still clean. Okay. Next, I'm going to take my ChloroPrep and I'm going to open it, not towards my patient, not on my sterile field. And I'm going to apply it with the motion of friction, so up and down here, across, right along the side. I'm going to contaminate my pinky, and I'm going to go right underneath there. Okay, I'm going to dispose of my ChloroPrep bag. It's in the bag. I'm going to allow that to dry. All right, it's dry. I'm going to apply my 2x2 right on top of the site there. I'm going to take my Tegaderm. I'm going to remove the film. And I'm going to apply the crease of the top of the Tegaderm to the top of that site there so it can mold it to the, and the sterile part of the procedure is now over. Sterile area has now been covered. Make sure the Tegaderm sticks nice and down to his skin. Nicely molded. And then on a piece of tape, going to write the date right here on my Tegaderm sheet. It is the 5th day, the 10th month, and the 12th year, and I did this at 1200, and I'm going to initial it. And I'm going to apply that to the Tegaderm strip. I don't want to write on my patient, it's actually very rude. All right, everything is intact. The lines are going back. I'm going to tape those back so that they're not flopping around. In fact, I think I'm going to use my soft tape because it is more comfortable for the patient than that medical tape. We don't want these flopping around, so I'm just going to tape them back right up here. So the tape is more gentle on the skin than the other. I'm going to cover my patient back up. Remove my sterile gloves. Put in the trash. I can remove my patient's mask now that the procedure is done. Remove my mask. And now that the procedure has been completed, I'm going to do hand hygiene again before I leave the patient's room. I'm going to make sure that the bed is in the lowest position, that the side rails are up, that he has the call-out within reach, and that he is comfortable. He doesn't need anything else before I leave the room. Mr. Thebeau, is there anything else I can get you? No. Okay. I'm going to make sure he wants to keep that pink bathrobe on. And he does. It's his favorite color. And then I'm going to go chart. I'm going to chart what the wound looked like. I'm going to make sure that that there was no drainage. I'm going to make sure that that's noted. I'm going to make sure that it's charted that the date and time that I provided the procedure of the dressing change, and that it'll need to be done again per hospital policy. And that is my CVC dressing change.